Hi, y'all. Welcome to our episode of our Let's Talk About Poop podcast. I am so excited today because I have a good friend on the podcast today, Dr. Jake Reddick. Now, Dr. Jake Reddick is the part owner of Preferred MD with Dr. Andy Gray, and he does concierge medicine. I've been fascinated with this idea because, in essence, you pay a one-time fee and you get universal and consistent care, unlimited visits for just a one-time fee. So if you've been frustrated with healthcare, with waiting at the doctor's office, not having the time to see your doctor, or wondering exactly what can I do to make sure that I'm taken care of and find out what's going on, I think concierge medicine is the approach you can consider. And with this interview with Dr. Reddick, you'll understand exactly what that is, and hopefully you can get a better idea of what you can do to take care of yourself and your family. Well, Jake, thank you for joining us on our podcast today.
Yeah, thanks for having me.
So why don't you tell my audience kind of what exactly do you do, kind of what is your job, and like what do you do?
Yeah, so I'm a family physician. That's my training, and my practice is a little different than your average doc. I'm in a concierge practice right now.
So what exactly is concierge? So when I hear concierge medicine, it sounds like, all right, like a hotel almost, where you kind of get the experience of whatever you need, whatever you want. So what exactly is concierge medicine?
Yeah, I think similar. So when I hear concierge, I think service, and really ultimately that's what the difference is. It's about the level of service that you get as a patient. So, and I think that in medicine and in clinics, especially around this town, they can give you tons of stories of poor customer service from the clinic, from the doctor, from everyone around. And so first and foremost, it's about service and taking care of the patient. So
how are you able to do that differently in concierge medicine than maybe traditional family practice clinics?
So the short answer is time.
Yeah.
Concierge doctor has more time.
Yeah.
And so that means they got more time for the patient. They're available for the patient. They're available for if the patient just needs to drop in unannounced because something's up, or something happened in the middle of the night and they need to come in that morning. Time, or could be where you've got a patient that has just a really difficult problem, like maybe their symptoms are very vague, or they have a lot of symptoms, but you've done all the tests and you just can't quite figure it out. Your average doc in the box, even your average PCP, they just don't have time to sit down and rack their brain and go over and over, or maybe spend that extra hour with the patient getting all of the history down and finding what's that one little thing, kind of like Dr. House does.
Yeah.
And that's been really rewarding for me as a physician in primary care, that I can take the time with a patient, and I can find, it's not that I'm smart or that I'm better at anything, but I have more time than most doctors. And so I can sit down and think about it. If I need to, I can tell the patient, well, let me stew on this, let me do some research, and then find out what is the problem. And oftentimes it's simple things that just were overlooked, or someone didn't have the time to put all the pieces together.
So when you say time, like on average, how much time do you spend with a patient? Because most primary care doctors, it's maybe 10 or 15 minutes. It just boom, 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 boom.
Yeah.
So when you say time, how much time do you actually spend on one patient, for example?
So the quick answer is as much time as we need. But on average, I see 3 to 6, sometimes 8 patients a day. And so if you contrast that with your regular doc's office, they're seeing anywhere probably from 20 to 40 a day. Yeah. They're just get them in, get them out.
Yeah.
And so I've got really all the time that I need. So if somebody comes in and they're having an asthma exacerbation and they just need an antibiotic and a refill on their albuterol inhaler, we can do that in just a couple minutes, get the patient home, and they're happy. But if somebody comes in, they're like, man, I haven't been feeling right, and we start to go through their symptoms, and let's say maybe it ends up being a mental health thing. Maybe they're suffering with depression. Now all of a sudden there's a situation where I might need to spend some extra time with this person to kind of get the root of what's going on, and I've got time to do that. So we structure the schedule in a way that we try and do just a couple annual physicals a day. So we'll split maybe one in the morning, one in the afternoon. And those we plan about 2 hours for our annual physicals.
So 2 hours for a physical, an annual visit. Wow.
Yeah.
That's crazy. Mm-hmm. So in that 2 hours, I mean, you must go over like everything that the patient could possibly ever want or need.
Yes, absolutely.
Yeah.
Yeah. And another way in which we contrast between the way we do things in your regular doctor's office. So I don't know if you've experienced now, but when you go in for your annual, which most insurances will cover an annual 100%, except if you ask anything outside of like the screening preventative medicine type things, they're going to charge you for a regular office visit as well.
Wow.
And it
That's crazy.
It blows my mind. It's like, so anyways,
but so nuts.
But no, so we do have a format that we go through on the annual physical. There's a series of questions and the kind of the SOAP format that we do as docs. I use that to kind of guide my exploration into their health. But then also any questions or concerns that they have, we're there. Generally, we try and have labs done prior to that visit so that we can spend time going over those labs. And then depending on the patient's age and demographic, any other screenings that need to be done, we try and get those done ahead of time so we can go over those. So, for your older females, a bone density scan, mammograms, for males, prostate, prostate stuff, testosterone levels, that kind of stuff. So try and have as much data ahead of time, and that gives us a lot of stuff to talk about. And besides that, there's time to get to know the patient, which I think is probably one of the most valuable things. Really understanding and knowing your patient. Then over time with that relationship, you can tell when there's something wrong with that person.
So you obviously didn't do concierge medicine straight from residency. So what did you experience going to, just regular family practice? And what did you notice there that made you want to go into more of a concierge type practice? So what did you notice? Like, what was missing?
Yeah, so I started my career at a rural clinic in Post, Texas, not far from Lubbock here. And, I really enjoyed it over there. One thing that frustrated me was just the pressures you get from administrations. That was an employed position. One of the big hospitals around here was my employer. And, they pressure you to do things a certain way. There's pressure to see so many patients in a day. There's even pressure to see certain kinds of patients more than others. They want you to see the ones that have insurance, the insurance that pays well. And that was all frustrating, but I was still young and fresh. It hadn't really gotten to me. But, and then that company, and as well, because I think you left that company at the same time I left that company. They were going through some changes, changing the way they reimburse their doctors. And it was going to equate to a large pay cut unless I increased my productivity. Which
basically just see more patients.
Exactly. That's what it comes down to. And so that led me to look for another job. And actually at the same time got recruited to federal prison to be the doctor out there, and that was also in Post at the time. And so that was also something I'd never even considered. I remember in residency looking at jobs, and I'd see a job ad for like a state prison. I'm like, who on earth? Why would anybody do this? And but I found myself in a position where I was at a point in a transition, and the opportunity was there, and the pay was really good. So I'm like, all right, let's give it a shot. And I really, really enjoyed doing correctional medicine. And it's funny. I think that a lot of what I enjoyed is the same things as what I enjoy doing concierge medicine now. So there's some similarities between those. So number one, we're not dealing with any insurance. Okay. So the primary goal is just to take care of the patient. Just to provide care. There's also a lot of flexibility in correctional medicine. To kind of structure your day and to spend as much time as you need with some patients and as little as you need with others. So, if it was a quick urgent care thing in the prison, take care of that quick. But then when there's bigger issues that come up, I'd have time to spend with those. And so I did that for a few years.
Yeah.
Started out at the federal prison in Post.
Yeah.
That prison ended up closing,
Yeah.
and so at that time I moved up to Lubbock County Jail.
Yeah.
Which also loved. As you can imagine, the flip side of working in corrections, there are different kinds of stresses that you experience that are not the same in the real world, I guess. You know, so it started to wear on me. I think just being around the level of suffering and mental health problems, and you know, I wasn't blaming anyone or the system for the shortcomings, but it's a fact.
It's hard.
It's part of our world that a lot of people don't really see. And if you're experiencing that over and over, day in, day out, it was wearing on me and my mental health. So similar situation, there was a change in contract there, and a new vendor was chosen for to deliver the medical care. And so that it kind of gave me an opportunity, well, do I want to keep doing this? And so and that's when I thought, well, actually, I had a conversation with my brother-in-law. I was really kind of stressed out about what am I going to do.
Yeah.
My brother-in-law, he's a great friend of mine and has given me great life advice many times in the short amount of time I've known him. And he said, Jake, sit down and think for a minute. Just close your eyes and say, if you could wake up tomorrow and do anything, go to any job you want, what would your job look like? And so I did that, and I'm like, well, I think concierge medicine would be really good. You know, I be my own boss. I can, you know, I don't have a lot of the pressures of the normal medical system that frustrate me so much. And so that next day, I just Googled in who's doing concierge medicine in Lubbock, and so Andy Gray came up. Who's my current partner, and I'm like, I'm gonna go talk with this guy and just kind of pick his brain and see is this something that I could do. Anyway, so I met Andy, and he's like, you know, I'm on my way out and you're on your way in. Why don't we work together, and when I'm done, you can take over. And so that's what we've been doing now. I've been working with Andy now for a few months and doing concierge medicine, and it's by far way exceeded my expectations of how much I would enjoy it in that time frame. So I'm super grateful to find this. It's kind of renewed my passion for medicine and taking care of people, and it's also comforting to know that I can now continue to do this and provide for my family in a way that supports my mental health too.
And your values too.
Yeah,
I mean,
absolutely. Yeah.
So you mentioned just now that going into concierge medicine kind of supported your values, and it was really just almost like eye-opening for you for this type of practice. So what specifically about concierge medicine have you found that is completely as different from the traditional routes you've gone through? In addition, what have your patients who do concierge medicine, what are some of the benefits they see from doing this type of model? Yeah.
So I'll give you one example. I would say, for me, what I get out of it is that I think I'm better equipped to take good care of my patients.
Yeah.
And I really believe that's because I have more time.
Yeah.
And so I have time to think, I have time to spend with them, I have time to research if there's something that I don't know. You know, and being in primary care, we know a little bit about a lot of things. And so often, I mean, every day I have to go look things up and learn more about something. I can give you a dozen situations where the patient is getting far better care because of our situation, because of the way we practice, than they would have otherwise. And so, like, one example, we got this one patient of mine who he would have these, he had frequent kidney stones, and then he was having frequent UTIs. Is an elderly guy with some mild dementia at the time. And as you know, when someone with dementia gets a urinary tract infection, an elderly person with dementia, then it can throw the whole world off, and everything gets worse. They get disoriented, they can get aggressive. And so this had been happening to him over and over and over. Come to find out, and kind of what I suspected is, I bet this guy's got like a really big kidney stone that's not passing, that's a nidus of infection or a seed of infection and causing this. And so he had been going to the urologist like frequently, and the urologist kept saying, "Oh, it's fine, it's going to get better."
Yeah.
Just not taking the time to listen.
Yeah.
So anyway, so we ordered a CT scan, and sure enough, there's massive stone that in the kidney that's way too big to pass, and that was the source of this. In his case, it was actually a candidal urinary tract infection, which is less common, but everything kind of fit together when we did that, and so we ended up getting him to a different urologist per the patient's request, and they did put a stent in and blasted the stone, and things improved for this patient. And so, really, it wasn't anything about me per se, and I don't think that I'm any better than the next guy, but it's that I had the time to kind of sit through and listen to the patient and take care of that.
That's amazing. Yeah, I think you're right. I think unfortunately a lot of us, because of the pressures of healthcare, seeing patients, it's the economies of medicine. We just patient. And you're right. We don't have the time to spend with our patients the way we want to, nor the way we should, to give them the best care. I mean, you're 100% right.
Yeah, I think along with that too, there's a bias that we have as doctors. We're biased toward the first thing that comes into our mind that explains all of the symptoms, which may or may not be correct. But it's like when you're cramped for time, okay, I've got 15 minutes with this person, and I want to help them. I want to provide them with an answer as well. And so there's a strong bias towards just picking, it's this, and it's probably going to get better.
Yeah.
So let's reassure them, and we'll give them this pill, and they're going to be fine.
Yeah, and you just hope to get lucky on that sometimes. So how does the model work? Because you mentioned that you don't take insurance. So how exactly does it work then for a patient who may be interested in this model?
Yeah. So for our patients, they pay $2,500. That's and that covers all the services that Dr. Gray and I provide for 1 year. And so that's
a one-time fee?
It's a one-time fee or an annual retainer fee is what we call it. And that they get everything that we do in the office for them for that. So things that wouldn't cover would be like labs. There's a separate bill from the lab company that they would get, and they can use their insurance on that if they choose to. Or, of course, hospitalizations, that's kind of outside of what we can provide. But everything that you would normally get from your regular doctor's office is what we provide for that $2,500. And so that allows us to have a smaller patient panel, and but still earn enough for us to support our families.
Yeah, just bypass insurance, which is the biggest pain for healthcare.
Yeah.
So for that type of service, like, what do your patients get? Do they get to see you like every month?
Yes.
Or how does it work? Or if they have a question, like, how does that work?
So typically, we want everybody to have an annual physical. Not all of our patients always do, but we encourage everyone. We want them to be as healthy as possible, and that we kind of see that as our kind of annual moment to really focus on preventative care. So we have our annual physical, but beyond the annual, it's unlimited office visits.
Unlimited?
Unlimited, yeah.
Wow.
So if you're a hypochondriac and you want to be seen every day.
You can be seen every day.
You can be seen every day.
Yeah.
We might grow tired of that, and maybe the next year we wouldn't renew you, but But no, really, and in some cases, that's the best cure for a hypochondriac is see them often,
it is.
and reassure them, listen to them, and so we do have patients sometimes that they come every month or every other month, and it's no big deal. I mean,
And so, like, if they have questions like after hours, or if they have questions at the weekends, like, how does that work?
So they can reach us 24/7. We do have a call service. So if they call the office number after hours, it's going to go to an answering service. They're going, and then they will relay that either to whoever's on call, basically. So it's going to be me or Dr. Gray on weeknights. And then our nurse, Laura, who's very experienced and has a great relationship with all of our patients, she does call on the weekends. So if it's something that she can manage, she'll take care of it. Sometimes it's like they need a refill and they waited to the weekend, and so she can go and take care of a medication refill or something like that. Or if she's really not sure and she thinks they need to talk to us, then she'll just text us, hey, you need to call so-and-so from the call service. So 24/7, any hour of the night, they can reach us, and we're happy to help.
So it's surprising, relatively, with patients with their insurance plans and their high deductibles, getting almost any service you want from a primary care provider for around $2,500 doesn't seem like a big jump for a lot of patients at all.
No, not at all, especially nowadays. I think maybe going back a few years, maybe it would have been a little different, but with the way insurances are, it's kind of funny, what was a low deductible plan 5 years ago, they still call it a low deductible, but it's a pretty high deductible.
It's pretty high. I know it really is. God's hard.
So if you think about that, especially if you're going to go to the doctor often, it may end up being a better value. I mean, and that's just by the numbers, and then considering also the value that you're going to get more attention paid to you from us and more peace of mind from us. Especially, we're in Lubbock, Texas. It's a smaller market compared to, say, Dallas, Fort Worth. Concierge practice there is going to cost you probably $5,000 to $10,000 a year. So it's more affordable here because that's what the market requires. And to be honest, it works just fine for me. I'm doing great with the way that we have it here.
What are some of the challenges you've noticed kind of in this type of model?
I will say some of the challenges are you may have a patient that has very high expectations, or as you could imagine, some of our patients, they are used to getting their way just by nature of what they do, or...
I mean, there's a certain expectation when you pay, a certain amount of money. You expect a certain service. If I go to a restaurant, I pay, $500 for a steak, for example, I expect the steak to be the best freaking steak it better be. Because I paid that much money. There's an expectation when you pay cash for a certain amount. Absolutely.
Certainly, and so I say sometimes we might have a patient that has high expectations. They want us to do what they want us to do. But that's not always what is the best thing for the patient. Right. And so for me and for my partner, I can speak for him, we draw the line. We are, first and foremost, we're taking care of the patient. And if there's a situation, let's just say, for example, with narcotics or something, somebody is demanding that they get this prescription, even though maybe it's too early to refill, or every month they call and say that they'd lost their prescription and they want more. I mean, we're going to tell them no. We're going to treat them regardless of their expectations. We're going to treat everybody to the best of our ability and the way that they need to be treated for their health. And so sometimes that does mean you have to disappoint some people, but I like to think we're doing the right thing for them.
Yeah, absolutely. You're being a doctor. First and foremost, treat the patient. Even if it's not what they want, you have to treat them as, like your patient. Absolutely.
Yeah, but I would say situations like that do happen. For the most part, though, after we've developed a really good rapport relationship with that patient, they trust that what we're doing is what's right.
So I guess one question is concierge medicine, is that adaptable to maybe more of the kind of the broader population in the U.S.? Because like we mentioned before, a lot of patients have a very high deductible. It costs a lot of money to see a doctor just for a regular visit. And just in terms of finances only, it may make a lot of sense for a lot of patients just to use concierge medicine because it's maybe cheaper than just the overall plan. So is this kind of model acceptable for the broader population, or is it maybe not at that point in time where concierge medicine can really handle kind of the general population health?
I would say a couple things to that. One, I think that it is potentially accessible to a broad amount of people. Most patients aren't used to this type of model, but like we've been talking about, the healthcare landscape has changed. The costs for things have changed. Deductibles are higher. And so I think it's weighing more on the side of this being actually a pretty good deal. And I think when you also consider the quality of service that you're getting and the quality of care that you're getting, in my opinion, it's a slam dunk. It's a no-brainer. Can everybody afford $2,500 a year for their primary care services? Maybe not, but I think that if people really thought about it and looked at what they're paying for the care that they receive and the quality of care that they're getting, I think a lot of people would realize actually this might be a really good thing for them. And further to that, I think that as far as some of the problems in our healthcare system today, specifically with primary care, I think concierge medicine is the antidote to that. I think that it also does raise some challenges. So let's say, tomorrow everyone switched and all primary care docs are concierge, then we're not going to have enough primary care docs. I mean, there's already a shortage of primary care physicians as it is. Most primary care physicians have a patient panel of like 2,000 to 3,000 patients, depending on situations, plus or minus that. And concierge, you're looking at more like 300 to 600 patients for a patient panel. So we would need a lot more doctors for it to scale across the whole nation, for example. However, I think that that's something that is feasible to do. It would take years to shift that way. We'd have to train more physicians and have more physicians going into primary care. But when you consider the satisfaction that the physician has from practicing that way, I think that is feasible because in concierge medicine, we're earning a lot more money than your average primary care physician, and we're having a lot more satisfaction doing it. It's a lot funner doing it. We're not being squeezed for every little thing from the big hospitals like all the other docs are.
Yeah, so you bring up a very interesting point because I think a lot of us understand that the current healthcare system is not working well for patients, for physicians, just for the whole healthcare system. And it seems like concierge medicine has found a way to not only do the best thing for the patient, but to do it in a way that can help patients out, avoids kind of the whole healthcare industry complex, and to actually provide in fact, a lot of cases, better care. So can concierge medicine be an approach for maybe fixing some of the issues with the healthcare system in the United States?
Yeah, absolutely. I mean, if you consider, let's just talk about preventative medicine.
Yeah.
So if you have 15 minutes with your patient, like how much preventative stuff can you talk about? I mean, even if we just consider cardiology, like cardiologists don't have time to do preventative medicine. They only have time to take care of very, very sick people that already have advanced cardiovascular disease. And so, prevention is kind of done at that point. It's an afterthought. You're just keeping them stable. And, that's all they have time for. But if you have, 2 hours with your doctor every year, there's time for us to look into all the genetic factors, all of the lifestyle factors, all the different things that are going to affect your cardiovascular health, for example. And we can prevent people from having heart attacks in their 50s and 60s, as opposed to now it's, I think all you have time for in that 15 minutes with a patient is really to tell the patient things that they already know, like you need to eat right, you need to exercise. Yeah, we know that. But there's actually a lot more, and there's a lot more that can be done to prevent a lot of the diseases that we're treating. And in many cases, specialists, they only have time to treat the very sick people. They don't have time to sit down and tell people how to never get to that point.
So Jake, who is kind of the best audience for concierge medicine, or who's the best patients, or what type of patients typically do the best in the concierge medicine model?
So I would say, I really do think it's for everybody, any patient, and we will take any patient that wants to join us. I will say our patient population, our current panel, kind of falls into a couple different categories. So there, on the one hand, you've got a wealthier patient that wants the convenience and the service of a concierge model. They want to be able to, I've got a lot of patients this summer that are traveling and they're going to places like Africa for a safari or whatever it is. And so they'll call us up and they're like, hey, I need you to put together a med kit for me for any possible thing that could happen. And so we'll talk about what are they doing in Africa, what kinds of things might they be exposed to. and put together, a med kit, and we'll send them a script for a bunch of antibiotics and anti-nausea, anti-diarrhea, anti-malaria, whatever they need for their trip. So that, I would say that's one group, and maybe in that same category are the high-earning professionals that can't afford to be sick. You got your bankers and your lawyers, they can't have a day off work. And so if they start to get sick, they want to be seen right away and get treatment right away, and we're able to do that for them. Yeah. I would say the other group of people that we tend to get are people that are more medically complicated. And so they found that in the current system, they just can't get the time and attention that they need to be taken care of properly. And so, we'll have people that have uncontrolled diabetes and high blood pressure, and it's just too difficult for them they need to see the doctor, once a month, or sometimes even more frequently. They need someone that's going to follow along with their sugars and be able to give them advice as to what's going on with that. And so those people, they tend to do really well with us because we can take the time that we need to kind of tailor a treatment to them. Yeah. In some cases, we may have to discover a primary cause for their, whether it's hypertension or diabetes, that isn't responding to the traditional medicines because it's being caused by something secondary.
Yeah, no, that makes sense. Yeah, I think those are the exact buckets that probably would do the best when it comes to time, either time for convenience or time to actually sit down with the patient and actually go through all their medical history. Yeah. That makes a lot of sense. I mean, time's the biggest thing, which we don't have in medicine right now.
Yeah, for sure. Yeah. And, I think convenience is a huge factor too. I mean, we've got, we do have a few young families in the practice, and we love young families. I wish we had more, but, there was, ever since COVID, if a kid even thinks about having a fever at school, the nurse is going to call them and tell the mom to come pick them up, and you need a doctor's note before you can come back. So we've had situations where there was a little girl, she had a rash, and so the nurse saw it, said, "Nope, you're going home." Yeah. The mom picked her up, brought her right over to us. I saw her immediately, diagnosed the rash. It's not contagious. Yeah. It's nothing that puts any other kids at risk. Yeah. And she's healthy to go back to school. Give her a note. She was back at school before a whole class period was even over.
Oh my gosh!
So she didn't miss any school. You know?
Yeah. Well, that's important. That's actually quite amazing that you were able to do that in your practice.
Yeah.
That's great.
And you can imagine too how exciting that is for me as a doc to be able to do that. Because any other situation, we'd squeeze them in when we could, but they're going to sit in the waiting room for 2 hours and maybe get sick from somebody there. Yeah. But no, we're able to, say, we've got time. Come down immediately. Yeah. We'll see you. Let me give you a note. Go right back to school if you want.
That's awesome.
Yeah.
And I wish I had that when I was younger. I wish my kids had that.
Yeah.
God, it's a pain in the butt. Try to get them in, see a doctor, wait for the note, come back the next day. Oh, it's so much more convenient. Are there any misconceptions about concierge medicine that you've seen, you've heard about, that you just want to kind of clear the air on and say, hey, this is not what we are?
Yeah. So I would say, I think one of the preconceptions is that it's kind of like bougie or fancy, and in some ways maybe it is, but it's not exclusive in that way. We have patients that are very not bougie, and we love them all. So it's not just for rich people, although I think it's easier for rich people to do. They don't have to worry about money quite as much, but at the price that we're charging, I think it's accessible for many people. I think it's a reasonable amount.
Mm-hmm. And so if there is a patient who is interested in concierge medicine and y'all's practice, what is the best way for them to contact you or contact your clinic so they can become a patient of yours?
Yeah, so we have a website, and there's more information there. And you can email us through the website, or you can give us a call but the website is preferredmd.net. And then also you can call us anytime. So the phone number is 806-785-0600. We've got a wonderful receptionist, Ruby, who'd love to say hi to you, and we encourage all of our patients or all of the people that are interested to schedule a no cost, no obligation consultation to sit down with me and Dr. Gray and we'll kind of talk about what we do, and we'll ask some questions about what that person is needing and wanting from their doctor, or if we were to be their doctor, and what kind of medical problems that they already have, and see if it's a good fit. We do that pretty regular, and like I said, it's no obligation, doesn't cost any money. Just sit down and talk with us and see if it's something that you'd be interested in. So far, since I've been on board, every single person that comes to meet with us decides to join the practice. And another thing, it's at any point, say you sign up tomorrow and you end up being, you never need us, like maybe for 6 months, and you're like, what, I don't think I need this anymore. I'm already healthy. I know what I'm doing. And you change your mind, we'll refund your money prorated towards the rest of the year at any point. So it's really, we're not trying to steal people's money. We want to provide them with great, excellent health care. A lot of my patients are surprised at, I will, if I've got nothing going on, I'll start to think about what are some of the more difficult cases that I've had, who are some of the people that are struggling with things right now, and I'll give them a call and say, hey, how are you doing with that blood pressure? You've been checking, or you've been exercising? And they're just amazed that the doctor's calling them to check on them and see how they're doing. So,
well, we'll make sure we'll put all the information on the show notes. That way people can contact you and contact your clinic, especially if they want to be a patient. Do you take patients only in the Lubbock area, or do you guys take patients outside of Lubbock?
No, we've got patients coming from New Mexico to see us, but I would say all over West Texas. We have quite a few patients down even close to El Paso, Alpine, that area. So they've usually the patients have some sort of tie to Lubbock, and that's how they've gotten to know me or Dr. Gray. But we can treat any Texan in Texas, and if they're from another state, as long as they come to visit us here, we can treat them as well. And we do have people that come far and wide.
I'm going to try something new here on this podcast, right? So you guys let me know about Dr. Reddick here. We're going to try and do a rapid fire set of questions. He has no idea what I'm going to ask him. I have no idea what I'm going to ask either, but let's see if we can do this. Let's have some fun. Let's end this on a fun note. So, number one, scrubs or pajamas? Which is more comfier?
Pajamas.
Pajamas, yes, I'm with you. I hate wearing scrubs. I'm wearing scrubs now, but I don't like wearing them.
I was debating, am I going to wear mine here? I'm like, no, I'm just...
You should wear pajamas, man.
Yeah,
you wear pajamas.
I should have.
Put on my scrubs. We could have tied, so that's great. All right, perfect. Have you ever diagnosed someone at a party silently? Like you go into a party, you're like, that guy's got diabetes. That guy's got heart failure. Have you ever done that?
Yeah, all the time.
Is that right?
Yeah, all the time. Yeah.
What have you noticed in parties that you've seen?
So, it's going to be the things that you can kind of see outwardly, even mental health stuff. Like I can pick a bipolar person out like that if they're particularly manic. But heart failure, you can see the swelling and.
I now judge people by how far off from their colonoscopy.
Yeah.
So I see like LeBron James, he's 44 years old. It's like, you're one more year, bro.
Yeah.
You're going to get your colonoscopy. So I do mine based on age for colonoscopy.
Yeah.
You're 45, 50, you should be getting your colonoscopy. Have you had yours done yet? So I think all doctors, we silently diagnose either our friends or people in our parties with whatever medical illness that they think they have.
Yeah.
100% true on that. No, I agree with you on that. What is the most ridiculous medical myth you've had to debunk? So mine, I'll tell you mine.
Tell me yours.
Probiotics. People are obsessed with probiotics. It can cure everything. Alzheimer's, skin issues, gut issues. Yeah, okay, there's some evidence there, but people think that probiotics can cure everything, and I've had to debunk that so many times. And there's a lot of good evidence it can help out, but it can't help out with everything, nor can you eat like crap and just take a probiotic and assume everything's going to be A-okay. So I've had to debunk that all the time in our practice.
Yeah, I think it's a tough one, though, because I'm thinking about it, and I'm like, there's probably a little bit of truth in all of them, but I think you're right. I think people take it too far. They kind of exaggerate. Like one would just be drinking a ton of water. It's like, on the one hand, that actually is very important, but it's not going to fix your high blood pressure or your diabetes.
You can't wash away the sugars.
No. Cinnamon and sugar, although there may be something to that. I actually learned cinnamon, so there's two different plants that make cinnamon.
Yeah.
Two different species of plant. And one of them actually can lower blood sugar.
Yeah.
but it's way more expensive.
Yeah.
And so most of what you see at the grocery store is actually the one that can't lower your blood
Oh, sorry,
sugar.
it's the cheaper one? Mm-hmm. I did not know that.
Yeah.
That's right. So what cinnamon, do you know the name of the cinnamon that can decrease your blood pressure?
I'll have to, we can put it in the show notes because I'm going to have to look that up.
That's right, let me know.
But yeah, I saw a cool video about that, and it's the one, and the difference is like the one has to be, the whole process is like done by hand because of just the way it grows and the tree that it comes from.
Yeah.
Versus the other one, they can mass farm it and have machines that can produce.
Is that right?
Yeah.
I did not know that. Okay, all right, we'll put it in the show notes then. All right, last question. Have you ever used your doctor voice to get out of a ticket?
No.
You haven't? Oh
No,
my gosh.
no.
So I did it one time. It did not work. Oh man, that cop was like, no way, dude. I am not going to get you. You're going to get your ticket. So I've tried. I have failed miserably when it comes to that. I have to give it to you, man. You've not used your doctor voice, and that's really good.
No, yeah.
What about whenever you get someone, like a bad customer service agent or a bad experience? Have you said, "This is Dr. Reddick here. I want to talk to your boss," or what? Have you ever done that?
Yeah, no.
No, you haven't. Oh man.
I try and be inconspicuous most of the time.
I like this guy.
So, yeah.
That's awesome. Cool. Well, Jake, thanks for coming on, man. I appreciate it. I know me and my audience will appreciate you being here, you doing what you do, you being a fantastic doctor. We'll put all the show notes in the podcast down below. So
Awesome.
thanks
Thank you. Yeah.